Hi, you're watching The Savera. This is Amarpal Singh before you. We are reeling under the severe heat wave condition, and we are witnessing that many of the children they are facing whether irritation in eyes, high fever, sore throat, and several other problems. So, to discuss about the health conditions of the children during this hot summer days and what kind of precautionary measures are required to discuss it, we are having with us Dr. Puneet Aulakh Pooni, who is the head of the pediatrics department over here at DMCH Ludhiana. Welcome, ma'am, to the Sovera.
Thank you. Thank you.
Ma'am, what kind of common health problems usually we witness among children during these hot summer days?
Before I start with the problems, shall I start why you should be taking care of the children
Sure.
during this time?
Sure.
Because the temperature is touching around 45 degrees. So if we have a dry heat which is 45 or more, or if you have a humidity with more than 40 degree, then the children may suffer many problems. So let's first discuss the problems and we can discuss what we can do to prevent it.
Exactly.
So the children who are coming with the fevers, high grade fever. If the temperature is say up to sometime it can go up to 102, 103 also. And if it goes beyond 104 or the patient starts becoming lazy, lethargic or having severe headache, then we say that patient may be developing heat stroke.
Right.
So fortunately heat stroke we haven't received any patient, but with hyperthermia few patients are coming.
Okay.
So their temperatures are very very high, and they are at that time they are sometimes they are sweating also, and they feel very weak.
Right. So, ma'am, what kind of precautionary measures are required? As you mentioned that high fever patients, there are most number of high fever patients you are witnessing.
So here I just want to tell the parents that sometimes parents are worried that high fever is because of infection, and sometimes they start with antibiotics going from here and there. But the difference between high fever due to infection and due to hyperthermia due to say environment is that during environmental temperature the hands and feet also will be very very hot.
Right.
Whereas in infection due to bacterial or other infections, the hands and feet initially are cold, and the child is very hot from inside. And another thing is that if you give paracetamol to a patient who's got hyperthermia due to environment, which we normally give for fever, it won't make any difference at all.
Okay.
Because it acts through center where the thermostat point is normal. It
Right.
is not because of some other problem.
Right.
In this child, you all need is lots of fluid and sponging.
Okay.
So the things what to do to prevent these type of heat related problems in children. Number one would be to avoid exposure during that time.
Okay.
For example, the maximum heat, the maximum intensity of heat is between 11 a.m. to around 4 or 5 p.m. So that is a time we say that do not go out for playing. I mean, they should be playing in the evening,
Right.
but not during peak of the
Right.
hours. And at that time, especially for younger children, I would say sometimes the mother goes to the market and the child is sitting in the car. Don't ever do that.
Right.
Because in car the temperature because of greenhouse effects may be many degrees even more than what is outside.
Right.
So we have to be very careful to avoid exposure. And number two would be to take care of hydration. The heat hyperthermia occurs initially, and if we are not very careful the patient may go into heat stroke.
Right.
Heat stroke is a very very serious, it may be life threatening also. 10 to 50% of patient may die due to heat stroke.
Okay.
Where the temperature becomes very high and all the organs may fail also.
Okay.
Patient may have seizures, irritability, child may become very irritable, patient may become unconscious also. So to prevent that, hydration is very very important. So for hydration, water is very good, plain water. ORS is very good. We make shikanji or lemonade at home, that is also very good. Coconut water is good. What we should not drink in summers, which can cause more harm than good, is your cola drinks.
Okay.
So all that name any cola drinks, all those fuzzy drinks, cola drinks, they are very hyperosmolar. In fact, these drinks may worsen the dehydration.
Right.
And second thing which we must prevent taking is plain glucose. You know that ad is glucon D. Plain glucon D is of no use unless there is lemon, which adds potassium, and salt, which gives sodium. So
Right.
plain sugar is of no use. Other thing is housing. In house also we should keep the curtains drawn, and we should use the fans, and if you have ACs that is also fine. And for clothes, children should be wearing loose summer clothes. That synthetic, that nylon type of clothes should not be worn. And when the child is moving out, the child can use the we still have not the use to using umbrella or a cap which is covering, because the children's surface area is more, they are more prone to dehydration. Then comes about the role of diet also. Nature is so great that we have those fruits during this time which are full of fluid. So melons are very good provided they are clean, and India problem is with the pesticides.
Right.
But otherwise watermelon and all those things, those fruits which are rich in water, those things are very good. So
Right.
light diet, carbohydrates and proteins, this type of diet, that should be able to prevent
Right.
the exposure to heat and hyperthermia.
And as you mentioned about different types of fluids as well as fruits, the dietary measures that should be required. But during it has been witnessed that children, they stop eating, they stop taking consuming the things. So what the parents should do at such conditions?
So if the temperature is too high and babies were out, then when the complications of heat, hyperthermia or stroke comes, then the child is not going to eat anything at all, and the fluids child may not be taking also. So if the child becomes lethargic, is losing consciousness, and is showing some irritability, change in behavior, and intake is less with decreased urine output, hasn't passed urine for 6 hours, that is a time when the child should be taken to emergency.
Okay.
But if we take all the due precautions, then there should not be any. And very important for parents that when you are sending the the bag to the school, the most important component of the bag is a water bottle.
Right.
During this time. So
Right.
make sure that you are giving a good size water bottle, so that child is having enough water intake, and tell the child also to drink repeatedly, so
Right.
that child does not develop dehydration.
Right. Is heat stroke cases, they are getting more common in children as compared to the adult?
Um, Fortunately in Punjab, because the housing and the AC or that condition, exposed children are very very less. But you're absolutely right, medically, biologically, children, obese people, and those with underlying chronic illnesses are more prone to develop dehydration and heat, because the surface area of the child is more compared to an adult.
Right.
So that is why the water losses in adult, as younger the child, more are the losses.
Right.
So if we are having 50 to 55% of our body as water, so females has like slightly 5% difference. Children have 70% of their body as water. So the high dehydration and the water losses in heat are more in children
Right.
compared to adults.
Right. And what we say about the rashes or the allergies in the eyes or the sore throat, these kind of problems are also being witnessed.
Directly, that our ward is this time it is full. This time the maximum problem we got was chest infections,
Okay.
and that was not directly related to heat, but more to this time it was very very bad season because of pollution.
Okay.
And because of after April the cases are still coming because of the all the farming and the wheat cultivation, all those things. But use of what is happening is that our air is already polluted. On top of that, we are telling the children to stay indoors. On top of that, we are using things like dhoof agarbatti, incense, which is equal to 20 to 30 cigarettes. And so it means we are exposing the children to already pollution, and pollution is one thing which worsens all the effects of heat.
Okay.
So not only heat, any disease, the pollution is going to cause the worsening of that.
Right.
So those things are definitely adding to that.
Right. And considering ma'am pollution, and even we believe that when we switch on the ACs, the moisture content it's get vanished. And what kind of steps parents should take?
Moisture content, fortunately nowadays ACs are very good. We should not be lowering the temperature too low. I mean, around 25, 26, even higher in if the child is very young. And we have a filter inside the AC which should be cleaned regularly, at least once a month. So that way air from AC is better than air from a cooler, which has more chances of especially if they're using the old what do you call that, khaskas, which is behind. If you use it and you are not cleaning it properly, that is more chance of having exposure to the small particles which can worsen asthma in case your child is allergic.
Right.
Otherwise even cooling by cooler is also very good. So we say do the sponging if the child is feeling, frequent bath is very good.
Okay.
Or if the child is feeling very hot, parents normally come, their child comes from school and my child daily gets fever and they're getting one investigation after another
Okay.
because child is hot in the 2 o'clock, but it may be because of all environment.
Okay.
And then they're worried paracetamol is not effective, so it is all maybe environment. So give him the child the bath instead of giving in the morning. Let the child have bath when the child comes from school.
Okay.
Give a sponging, loose clothes,
Right.
and all those things would definitely help.
Right. What kind of misconceptions you are witnessing among parents
Regarding
regarding the way they are using home remedies to treat the children?
uh, regarding this misconception, unfortunately, as doctors, I would just like to say that antibiotics are not antipyretics. Antipyretics are drug we use for fever, which is because of infection. Antibiotics we use to kill bacteria. They do not affect viruses and nothing else. So I just want to give one message to all the parents. Your children are going to survive for next 70, 80 years. And now no company is bringing new antibiotics.
Okay.
And now what antibiotics we are using currently in the ward, which was synthesized 50 years back, very toxic drugs because there are no antibiotics in the market.
Okay.
Majority of time antihypertensives, antipsychotics, anti-diabetic medicines are being made.
Okay.
Why companies are not making? Because you make antibiotics today and the resistance may develop after 2 or 3 months.
Right.
Because antibiotics are available around the clock. Chemist is able to give antibiotic. If I've written once in a while, 6 years back, the child for the next many years, child is getting the same antibiotic with the same dose because mother can get the antibiotic from the drugstore. So my request to parents, if there's a fever, show that child to the pediatrician before just giving antibiotic at home. So that
Right.
misconception that the common cold no bacteria causes cold or cough, lots of cold and cough, give some antibiotics. So I really have to spend extra time because protecting antibiotics
Right.
will be saving me and even my generation also, because we don't have in the future. What will we do? We'll all die of infections.
Right.
So what we say is don't use sword where you can use a knife to cut the vegetable.
Exactly. Thank you. Thank you so much, ma'am.
Thank you.
So she is Dr. Puneet Aulakh Pooni, head of the pediatrics department here at DMCH, and she has briefed about what kind of health conditions, what kind of diseases children commonly face during these hot summer days, and what parents should do or and what they should not do during this, and how they should take the precautionary measures. So we will keep updating you. Stay tuned to the Savera for more updates. I'm Arpal Singh with cameraman Sandeep Singh.